So what is sleep apnea? We hear this term a lot and lots of people talk about sleep apnea, but what actually is it? So sleep apnea is when during sleep we get relaxation of the upper airway, and that causes either a partial or a complete narrowing of the airway. If the airway gets partially narrowed, sometimes we might hear that as noisy breathing or sometimes snoring, and if the airway gets more narrowed, then that can sound like someone's gone quiet, and then they may get an abrupt starting up of breathing with a gasp or a choke or look like they're restless. So generally, if there's snoring and breathing is irregular or sounds like it gets quieter, interrupted then by these gasping or choking, that's what sleep apnea sounds like to a partner. What actually happens with sleep apnea is that while we're sleeping, we get relaxation of muscles in the upper airway. The tongue muscle's the largest of those muscles, and it can tend to fall back towards the back of the airway and is responsible often for most of that narrowing. Other structures in the airway can also cause narrowing, such as the tonsils or the side walls of the airway, or if we're carrying a lot of weight, that can also cause the airway to be narrow just through having a lot of fat around the airway. If the airway's narrowing repeatedly like that during the night, that's when it starts to have an impact on our sleep. It can make us feel like sleep's disturbed or disrupted, or we're aware of waking with difficulty breathing. And if that disruption of sleep is happening often enough, it can just seem like sleep's not working and that we're feeling tired, waking in the morning feeling like I'm just, haven't had a good night's rest. A partner may see snoring, but doesn't always have to see snoring, and there are some forms of sleep apnea where really it's just noisy breathing or irregular breathing is what a partner may notice. Each time the airway narrows and there's this abrupt awakening or we need to open up the airway, it has an impact on blood pressure and heart rate. And over time we think that increases the risk of cardiovascular problems such as high blood pressure, heart attack and stroke. The disturbed sleep associated with sleep apnea also has an impact on our mood, increases our risk of depression, as well as making it more difficult for us to deal with stress, so increases our risk of anxiety. If sleep's disturbed and we're feeling more tired than we would be otherwise, there's also an increased risk of accidents. People with sleep apnea are at least double the risk of motor vehicle accidents as those without sleep apnea, which is why it's important to be careful driving if you think you may have sleep apnea. And people are also at increased risk of work-related accidents, so accidents in the workplace, or if people are doing more professional or thinking work, errors or mistakes in the workplace. So sleep apnea is important. It has significant cardiovascular and health effects in the long term, but can also have those short-term effects of increased accidents. If you or your partner think that you may have sleep apnea, either because of symptoms or something that your partner's seeing, it is important that you discuss this with your doctor.
For the A to Z of sleeping well, head to the Hub, sleephub.com.au.